Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408-687-1899. Email address homeomedicine@yahoo.com. Anytime when you are tired of any treatment at any age for any disease, call me for second opinion of your disease. And also, if there be no progress in your treatment, I can give you my opinion based on the natural principles. Natural principle means when there was no medical science, even then we were getting diseases and human beings were getting cured as well. And how they were cured, that was all dependent upon the nature, how the nature was curing the diseases and how the system was curing himself and protecting himself. So all these things, according to that principles, which we have studied in medical science and medical colleges, and that I can guide you with that one so that you can understand what's the problem, why you are not getting well in your disease. So let us come to the today's lecture. We are passing through the abdomen because systematically study is going on that we are describing all the different organs of the body, a part of the body, head, neck, thorax, and abdomen. We have entered into the abdomen, and I have described about the boundaries of the abdomen, upward, and boundaries of the abdomen downward. And also, after that, I divided this abdomen into 9 different portions. And after that, after describing these 9 different portions, I explained about all the different organs situated in these 9 different portions. Every portion, every segment out of 9 segments, they have different organs. Some of the organs are common organs, which are passing through many of the more than one quadrants or more than one part of this abdominal sections. Ultimately, after describing all the organs situated in the abdomen and different sections of the abdomen, we started describing if there be any problem, what will happen, what will be the characteristics of the pains, how we can describe that this pain is related to the intestine, how we can describe that pain is related to the kidney, liver, gallbladder, stomach, whatever. So all those things, yesterday I described the Hindi lectures. I will repeat a little bit, and after that we will go for the and next section. Pains we described like a burning pain, pinching, pricking type of pains. And the explanation for that one I gave you, just like you feel pricking pains in somewhere. The pricking pain indicates that all the organs have a circulation setup with which arterial blood is coming inside and providing food and the oxygen for the survival of those organs and those cells and tissues as well. And after that, back going, returning blood contains the garbage of that cell as well as all other products which that organ has prepared for the use of other organs or for the special garbage to be evacuated from the body. In this way, when there is a pinching pain, pricking pain, it indicates that something wants to come out. Something wants to come out from inside, and still the outer covering of each organ is not allowing him, permitting that thing to come out from that overlapping of the organ, because all the organs are overlapped. All the organs are overlapped by some membranes, and when it is not coming up, just like the skin, It has epidermis on that one. So in this way, when the internal garbage or internal something is not coming out from the organ, it pinches from inside, it pricks from inside to go out. And ultimately, what we do, if it's outside on the skin, we scratch it. We scratch and the you can say the holes in the skin becomes dilated, and that things comes out, and you feel relief. How you feel the relief? That something which was pricking from inside out, punching, that has been evacuated from the skin by our scratchings. The holes of the skin are dilated with that one. So this is normally happens, and I give you the example of skin so that you can understand easily. But the same thing happens in the internal organs as well. In the internal organs, when there is a normal way that blood is going in and blood is going out, and also along with that, the lymph channel is lymph is going out from the organs, and also the nervous system is going back and forth uh, to send the messages. So ultimately, all these four things are going on, but even then, there remains something else inside the organs, inside any part of the body that that wants to come out has not been evacuated by the blood circulations. Then at that conditions, we feel a pricking sensation because something wants to come out, just like the fishes are jumping out of the water. They want to go out. Though oxygen is sufficient in the water, their lungs are prepared to take oxygen from the water when they swallow the water of the sea inside, but still they need to take a breathe in the open air to take more air. That's why they jump up. The same thing happens in each and every organ. Then, when something wants to come out of the organ, is not easily coming out because of the coverings on the organs, it causes pricking type of pains. And then, same way, the burning type of pains. The burning type of pain where there is a something a reactionary appears, just like in the stomach. Reactionary what appears when anything goes inside the stomach, there is a protection of the acid. Acid is prepared for that one, but if it's not used at that time, because suppose when you take food and the acid starts coming out, pouring out from the upper portion of this stomach. But suppose if there is no food and still there is a sensation, because that sensation may be produced by the anxiety, tension that activates the 10th cranial nerve, vagus nerve, which supplies the stomach. And under those conditions, stomach falsely may understand, may feel that something is going inside, and but there is no food. Under those conditions, the acid is poured from the upper area, and that causes the irritation in the stomach. And body wants to expel it out because it is unwanted. Whenever there is anything unwanted goes inside the body wants to expel it out, and this expelling it out is known by two words. That is one, excretion and secretions. Excretions are throw out from the body like stool and urine and sweat and perspiration, breathing, uh, but secretions are taken inside and used by the other organs for their purpose. One thing I have extra, or one thing I prepared that one, and I send at your home. You utilize that one. Okay, the same thing happens in the organs. All the organs are producing something, and some of their production is sent out from the body, but some of the production of their produced by any organ is used by the other organs inside the body. So this is what going on. But if something extra is remaining, residual, that's known as the residual portion of the garbage is still remaining inside any organ, that causes pain, pricking type of pains. And the same way, I just give you the example of the acid, HCl, acid in the stomach. that stomach, that acid is produced, but that's unwanted because there is no food. And when anything comes unwanted inside any organ, body wants to expel it out because this is unwanted. And that thing, which whatever has come up, though it's a product of the body, but even then, where it is going, it's illegal. Acid is not supposed to be produced without food. And when the food goes in, the acid is produced over there, and then that acid goes through that food, kills the bacteria and everything, whatever is going by the food from the mouth inside, they kill it. And ultimately, to neutralize the extra acid which is going through the food inside the stomach to the lower wall, that is neutralized by the pepsin. The nature has made that kind of arrangement inside the body. But I'm talking about the unwanted production of that acid that may result because of the anxiety, because of the tension, or because of something else. Because of these things, the 10th cranial nerve, the vagus nerve, is stimulated, and with that impression, stomach is irritated, and the first portion of the stomach, the top portion of the stomach, produces the acid. But there is no food, unwanted things. Then nature wants to expel it out. Acid is burning. So, under such conditions, there may be vomiting, there may be nausea tendency, there may be a burning sensation, and if ever there be vomiting, that will be acidic type of vomiting. All these things normally we see happening. Most of the people that might have experienced in their life vomiting, nausea tendency, and the characteristics of those vomitings explained yesterday. The characteristic of the vomiting is if there is only acid, that's a burning type, and sour type of that is the sensation of the sour type of. And also if the food goes inside from the stomach to the intestines, and where there is a bile mixed coming from the liver, bile is mixed into the intestine into that food, and also the pancreatic juice, that is insulin, also mixed into that one. And ultimately still there is a time that it cannot go too far to up to reach up to the anus to go out from the body. Body tries to bring it out from the backward. That's known as regurgitation. Via the regurgitation, nature wants to expel it out because this is unwanted thing, and it is not required by the body. And as soon as, means whatever the way is shortest way, the upward is shortest way, though it's difficult to go back, it's difficult, but because there are many more closures, many more openings are closed when the food comes downward, the upward it's closed. In this way, it's very difficult for the food or the acid to go out via the vomiting. That's why vomiting is not the easy thing. Stool is easy thing in a normal thing, in a normal person's, but vomiting is not an easy thing. It's a difficult, it's painful. So, but that vomiting will be acidic, that vomiting will be sour, that vomiting will be green or yellow, depending on the bile's condition, because bile has in it the fractions of the iron, subdivided iron. Iron makes the bilirubin and biliverdin. Their color is green, their color is yellow. And when that yellow color goes over there in excess, and that is vomiting out, that shows the yellow color of vomiting, and that is sour in nature. Sour. Teeth are sour, mouth is sour, everything. That indicates that something has, maybe food, maybe without food, acid has gone into the intestines from the stomach, and then nature thinking it's unwanted and wants to expel it out. Though it's very difficult, but it has been expelled out. And when it comes in the vomiting shape, it's sour, it's acidic, it's a foul smelling. All these things are added to that one. So, in this way, this is what I explained yesterday about the stomach, about the pancreas, about the bile duct, why there are pains, and if there be pain, what's the referral position, what's the route of those pains to advance, all these things. Because I route of any pain is according to the structure of that organ. Whatever the structure is, or whatever the normal movement of that organ is, that pain travels to that sides. Intestine pain, either it is in the stomach, or regurgitation, it's upward. If it normally goes downward, pain or anything may be felt into the abdomen or the umbilical area, because the first portion is the small intestine, and that small intestine is localized into the around the umbilicus. So pain is felt over there. In this way, in 2 days, we have described about the pain in the right hypochondriac. There is a liver, there is a gallbladder, there is a ascending colon of the large intestine. The intestine is coming upward. The large intestine is coming on right side. It is coming from downward to upward. And also there is a flexor that is known as hepatic flexor, where this large intestine takes turn from right side to the left side. That also includes in that one. And after that, we reach to the middle area, that is the epigastric area. And I described just now, I repeated it, that you feel pain in the stomach, and that pain may be burning type of pain. And that pain indicates that there is excess of acid. Or if there's food, we can say the excess of, with the food, if you feel burning pain in the stomach, it indicates the acid is in excess. Suppose there is no food, but still, because of the 10th cranial nerve, anxiety, tension, everything has irritated your 10th cranial nerve, and there is a production of acid inside the stomach, even then there is extra, because there is no food. Extra acid, nature wants to expel it out, and you feel burning pain. That's the nature of the acid. Burning pain inside the stomach, and it is relieved only by the vomiting. If there is no vomiting, it feels very awkward, very painful, disturbing, restlessness in the stomach and all that area. So after that, we talked about the intestine, the transverse colon, because the large intestine from the right side, it goes to the left side, and the middle area, from right to left, the middle area is known as transverse colon. And that transverse colon is passing from this area, from the stomach, and also under that portion of the esophagus, which is only just 1.5 inches area. When the food pipe, that is the esophagus, coming from upward goes downward to meet the stomach, and after passing the diaphragm, reaching to the stomach, there is a 1.5 inches area, and that is also pressed with that. Under those conditions, there is uneasiness in the epigastric area. That's known as the epigastric. Epi means upward. Stomach means up above the stomach. So above the stomach area, we feel uneasiness, irritability, because the large intestine is passing from that one. Because of that problems, this food is stuck up in between that area, passing from the diaphragm, which is the border between the chest and the stomach, and but it has not gone into the stomach, because that opening, that is known as the cardiac orifice, that opening is still not fully opened, and the food pipe at that within 1.5 inches area is blocked, is filled. Under those conditions, there is uneasiness, and people will say, "Oh, since I eat food, it is stuck up here, as if it has not gone down. It is stuck up here." And I feel uneasiness because it is pressing the heart. Right ventricle of the heart is very closer to that one. Ultimately, it causes problems all where. Suppose if any street is blocked, it will cause problems to the all persons who are passing through that street. All other houses which are at the distal portion of the street, they are coming back, coming out, or some people are coming from outside to inside. They will be feeling problems with that one. The same thing happens in this area. This is what I described to you, because it is not going upward, it's not going downward, unless they release downward, unless with the vomiting they go upward. it causes uneasiness. So this is what yesterday we described about the characteristics of the pains and all that. And now we are at the left side of the abdomen, right side liver area, right hypochondria. Hypo means under, chondria means ribs, lungs. And under the lungs, that area is known as the hypochondria. And the left hypochondria under the left lung area. And now we are at left lung area, below the left lung area, as I described many times, that up to the ribs, the area is allotted to the chest. And after the ribs, area is allotted to the abdomen, and there is a partition that's known as diaphragm. But one thing, there is an exception, that liver on right side, spleen, tili, spleen on left side, they are the portion of, they are covering the space of the lungs under the ribs. But why they are considered the abdominal organs? Because all the abdominal organs are covered or wrapped in a wrapper that is known as peritoneum. So means all these organs are wrapped up into the peritoneum, and that is why they are the organs of the abdomen, but they are covering the, on deputation, you could say, on deputation, they are lying under the ribs and covering the area of the chest. In this way, sometimes someone may be confused, but when they are lying under the ribs, they remain inside the ribs. They are not allowed to come outside the ribs. If they come outside the ribs, they are abnormal. They are sick. They are diseased. Even liver, or on left side there is a spleen. Both are abnormal if they come out of the spleen. When I say, okay, you have to go to your maternal house, then you should live over there, maternal house. But if you come out of the maternal house, then automatically it will be a problem because you are settled over there. So in this way, liver or the spleen, they are organs of the abdomen, but remains inside the ribs and taking the space of the chest. But if they come out of the ribs downward, they are abnormal. This is the first very sign in these two quadrants, right side, right hypochondriac, and left side, left hypochondriac regions. If the organs, the main organs, liver and spleen, they comes out, they are abnormal. Now, we have to discuss today the right hypochondriac region. The first of all, what are the organs inside the left hypochondriac region? It's not only the spleen. We are discussing about the abdominal parts, and the abdominal left part is known as hypochondriac area, and hypochondriac area has many more other organs situated in that area. The first area, the big organs I describe, is the spleen, the tili, and other organs in this side are, the first thing is the large intestine, because large intestine from the right side is going to the left side. And under the spleen, because spleen is inside the ribs, under the spleen, this large intestine turns downward, transverse colon, take a curve, and that curve is known as splenic flexor, turns downward, and it is known as descending colon. Intestine is made up of colons and flexor. Colons, long area, flexors, turn. The first turn was the right hepatic area, that is right side. Okay. hepatic flexor, that is known as hepatic flexor. On the left side, the large intestine take a turn and goes downward. That is the splenic flexor. So first spleen, second large intestine, portion of the transverse colon and portion of the descending colon lies in this area, and this flexor, splenic flexor. After that, the portion of pancreatic root, pancreatic tail, you can say, because its head is on the right side, on the middle of the abdomen, and the tail goes to back side, and that is covering up to the end of the hypochondriac area. Other thing, as I told you, that under the lower areas, from all these three areas, there is a lumbar area, and on the right side there is a right kidney, on the left side there is a left kidney, and because of the liver, a big organ, right kidney is a little lower than the left kidney, spleen is little smaller than, and that is why the left kidney is little bit upward. So these are the normal position of that one. It means, why I am telling this thing, it means the problem of the left kidney and the left gland, suprarenal gland, because there are two glands situated on both kidneys, right suprarenal gland on the right kidney and left suprarenal gland on the left kidney, and these portions are also lying, or you can say the jumping up into the left hypochondriac area. So it's very clear that if there be any pain, it may be in the spleen, it may be in the suprarenal gland, it may be in the tail of the pancreas, it may be in the large intestine. So all these things now we will describe one by one, that what it is, how we can differentiate that one. So first characteristic of every pain is the pains are migrated, pains are radiating. I describe it very well, these two terms. Pains start in one local area, and first of all, the patient will say, "Oh, I have pain here." Okay. Doctor will ask you, is it remaining here, staying here, or going somewhere? And if ever the patient says, it goes to right, it goes to left, he will say, in what basically he is explaining that this pain is concerned with the intestine. If it says that pain is going to the left side, pain is going to the downside, clearly it indicates that it is in the large intestine. Second, the characteristic of the intestinal pain is like movement of the earthworm. Just like earthworm moves like this one, this is known as peristaltic motion. These are the normal motion of the intestines, and when food or anything, even maybe any gas formation or anything, it will move forward. Where is the normal direction of the intestines? So he will say, my pain is migrating or my pain is radiating to this side. And then we can easily figure it out. Suppose if it's a pain in the spleen, it will lie localized. If it's a pain in the intestine, it will be moving. It will be like a earthworm type. Because food inside the intestine, it does not mean that we put food into the mouth and directly it will jump down. No, it goes regularly by peristaltic motions like earthworms movement. So in this way, if the pain of, because nature wants to expel it, whatever is there, which is causing pain, which is causing problem, nature wants to expel it out anyway, and that is with the normal movements of the intestines. Normal movements of the intestines are only measured once in every 5 minutes. we can see that the big movement. But if these movements are increased time and again, it's increased, what will happen? Whatever the stuff is into the intestines, it will move fast, fast more than normal. That's why doctor people say nowadays you can heard the word IBS, irritated bowel syndrome. Bowel means intestines. Irritated means they are irritated, more irritated. The movement of the peristaltic motion is more than normal, and it means the food will reach to the destination up to the anus more fast, easily, and people will be having diarrhea. And with more irritations and with more all these problems, there may be blood, laceration of the inner mucous membrane of the intestines, and the irritation of the internal mucous membranes, it may cause bleeding. There may be blood in the stools. So all these things we can figure out from the intestines. IBS, irritated bowel syndrome. If the peristaltic motions are more than normal, but if the peristaltic motions are even normal, but person feels pain, it indicates that something is stuck up into the intestines, and intestine wants to move according to its own speed, and that is why the patient will say, my pain is going from this side to this side. Wherever he will give you the directions, he will not say from the stomach to the right side. He will say from here to left side. Means there is a direction of the intestines. So it means we can easily figure it out that his pain is concerned with the intestines. Second, pancreas. I am taking up the spleen later on because I have to describe many things for the spleen. So, if there is a pain in the pancreatic tail, it mostly goes to the backward. Backward. Sometimes we are confused because the pain in the kidney, pain in the renal area, mostly starts from back and goes to front to the urethra. There is a direction of that pain. If pain is concerned with the kidney, it starts from the back, goes forward, and then downward. This is the direction of the pain in the kidneys. But I am talking about the pancreas, which produces insulin, which controls our sugar metabolism. That pain starts wherever it is in the in this left hypochondriac area, because it starts in the middle area, epigastric area, and the tail of the pancreas goes backside. The pain starts anywhere from the pancreas, goes to the back. There's a difference. We can ask the patient. You can ask any person who is suffering from. Your pain starts from the back, or pain starts from the front of the abdomen? If it starts from the front of the abdomen and goes to the back, this pain is not of the kidney. This pain is of the pancreas, maybe in the suprarenal gland. But if the pain starts from the back, lumbar area, goes to front, then goes downward to the urethra, to the ureter, to the bladder, to the urethra. This is a route. It's a route. It's a roadside for the kidneys. So then we can easily imagine that yes, this pain is concerned with the kidney. Or if it goes backside, this pain is related to the pancreas. But remember, the area is left hypochondriac area, left side of the abdomen, under the ribs. This area is left hypochondriac area, or also known as splenic area. So two things I described about the pancreas and also of the renal pain, if there be anything. Third thing, because our stomach is a J type, but the body of the J is curved, just like curved. And then that also falls that curve of that stomach falls in the left hypochondriac area, and there is a region of the acid production. The upper portion of the stomach and the back portion of the stomach, there is a production of the acid. If there is a burning pain, and burning pain starts in the left hypochondriac area and going toward the umbilical cord, going toward the mid of the stomach, mid of the abdomen, you can say. That is the pain in the stomach as well. And the characteristic of that pain is a burning pain because it is acid. Because of the acid, it's a burning pain. Yesterday, I described about the gastric ulcer and peptic ulcer. I can just again repeat because this is very important thing. Many people suffer from the gastric ulcers and they do not know how to differentiate this thing. This is peptic ulcer. Basically, these are ulcer. Maybe in the duodenal area, maybe in the stomach area, there is ulcer. And ulcers are produced because of the excess of acid or because of less pepsin. Means even acid is in less quantity, but there is no pepsin, then ultimately the small quantity of acid can produce ulcer in the stomach. So that's why sometimes you might have the prescription from the doctors. They write something for the pepsin, okay, any tonic or any liquid type of things which contains pepsin, Pepsodent or something like that, or antacid type of things, alkaline type of things they prescribe because the pepsin was less, acid was more, and that was causing the reaction. So they give something to neutralize the acid, and then you feel better. So I'm talking about this left hypochondriac area, that this back side of the stomach is lying inside this left hypochondriac area because it's a curved type. It's a curve. This back side is lying on the left side. And that's the area of the acid. And also the stomach acid. Sometimes we call the stomach acid. If the acid is produced more, and even without food, if there is a food, yes, definitely that acid will pour like a shower and it will kill the bacteria inside the food and everything. But if sometimes there is a tension, anxiety, many other things may cause, even hypertension, may cause irritation of the 10th cranial nerve, which irritates the stomachs, and ultimately the acid is produced. And then there is no food in the stomach. Then that acid can cause ulceration inside the stomach. And those ulceration, when you take food, food falls on the ulcers, automatically it will pain. Even if there is a ulcer on your tongue, on your arm, if you touch that one, it's painful. Then food comes from upward, goes to the stomach. There is a ulcer already, and it will be painful. If the pain starts after eating, that is the gastric ulcer. But food into the stomach remains about 30 to 45 minutes. In this time, acid is mixed into that one to kill the bacteria or any other unwanted things coming from the mouth downward. Also, gastric juices, the pepsin and all that are also mixed into that so that it is neutralized and it should not harm the walls of the stomach. Then, within this 30 to 45 minutes, food goes out from the stomach. And when food goes out of the stomach, if there is a less pepsin, if there is a excess of acid, ultimately it will cause ulceration in the first part of the intestine, that is the duodenum, in the small intestine. And those ulcers will cause you pain will produce a pain after 45 minutes of eating. If the pain starts after 45 minutes of eating approximately, this is peptic ulcer, because it is because of the less pepsin. Pepsin is antacid. Pepsin is neutralizing the acid. So pepsin was less. That is why this acid is produced. And that acid is produced in the first portion of the small intestine, that is the duodenum. And the pain starts after eating 45 minutes approximately, when the food starts going out from the stomach. So this is what I described yesterday. Now come to the again to the left area. Left hypochondriac region, we describe the kidney pains. We will describe it again tomorrow, because today is not the time for the lumbar area. This is the time of the left hypochondriac area. But when I start explaining all these things side by side, I want to explain everything, whatever is related to that one. So that is why I told you about the renal pain. What's the direction of that one? What's the direction of the pancreatic pain? So pancreatic pain from front goes to the backwards. Renal pain starts from the back, goes in front, and downward to the urethra. So these are the directions, so that we can identify them, what type of pain it is. Now, the major organ remains in this area is the spleen. And many times I have described this thing, but again, it needs to be explained fully. Purpose of spleen. Purpose of spleen is to scrutinize our blood cells. Blood cells are formed in the long bones of our body, and then they are transported into the blood. That blood carries to the new cells to the spleen, and spleen check them. It's a custom department for that one. Check those blood cells, whether they are competent to work, to go inside the body or not. And then ultimately, if those cells are competent and are normal in structure, they are again sent to the bloodstream to work normally. But if the cells are not normal, if the cells are not normal, bones are weak or something else, some, you can say the rickets type of diseases, children's, even Sokra and marasmus type of diseases to the persons that they do not have well fed, they do not have the sufficient foods and all these things, whatever is required for the development of the body, then ultimately the cells will become weak. And ultimately, these type of condition produces a condition that is known as sickle cell anemia. Doctor goes to the lab and they check your blood, and ultimately they, oh, you have sickle cell anemia. Weakness, breathlessness. When a child walks, when a person walks, he feels breathlessness. He goes to the upstairs, not the older person, persons like me, if you go to the upstairs, definitely they will be having a little breathlessness. But if a healthy person, if a young boy goes to the upstairs and feels breathlessness, it means the cells are not carrying sufficient oxygen which is required by the body. Then body demands it. Body demands it and order the lungs to breathe more. The normal breathing is 14 to 16 times per minute, but body demands more. Then lungs are to work more than 14 times to 16 times to 20 times, 24 times or more times. We like do this one. This is breathlessness. And this is because the cells which were prepared by the bones were weak, and they are circulating inside the blood. Their structure, their formations, we know that. As a doctor, we know that. As all the laboratory technicians, they know all this thing. But this, when the cells are not in their normal shape, it means the train compartments are smaller. They will not carry the normal load, or they will not carry the sufficient passengers. Ultimately, It will be difficult. The same thing, if the cells made by the bones are not sufficient normal, then ultimately they cannot carry the normal load of the body, of the oxygen, of the whatever else, whatever they are carrying, or whatever they are to do in the body. So ultimately, when they go to the spleen, they are either swallowed. That's known as phagocytic function. Kidney dem- demolish them. Okay, this is not good. This is not good. Demolish it. Again send to this blood stream. It will go again to the bones, and again they will reform the cells. But ultimately, the bones are weak, and they will be preparing the similar type of. If factory is not working normally, whatever it will bring weak. Will not be normal. So same way, the cells which are coming to the spleen, and spleen is checking all those things, that if the cells are normal, it is sent to the stream, but it is a regular process. Regularly, every day, every moment, new cells are produced, and every day, every moment, old cells are dying, because the life of a cell, note, life of a cell is 120 days. It means we die after 128 days, but we are still surviving, because the cycle is continued. Old cells are dying, new cells are taking their place. But if the new cells taking their place are weak, they cannot carry the more load on that one. Whatever the old new cells and healthy cells were carrying the function of the body, they will not be able to. So person will become weak. Oh, since he falls sick, since he's having cold, since he's having malaria, after that he did not get well. He is tired easily, breathlessness, and all these things. He cannot go upstairs. All these things. He cannot walk fast. This thing happens because now there is a suppression in the long bones as well, and the long bones are not preparing the cells quality. Cells quality is not good, and that quality is going to the spleen, and the spleen is scrutinizing them, checking them, and it send it back to the bones. No, 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 you have not prepared the good bones, good cells. Take it and re-prepared. But the factory is weak. What he will do, the same thing will happen. The same type of thing, just like the sickle cell anemia. Many people are weak. Oh, your hemoglobin is less. Okay, normal hemoglobin is 14.5 gram percent. It's measured like that one. And in the Indian peoples, it's not normally 4.5 milligram gram percent. Uh, Normally it remains 12, 13 as an average. But here I have seen that people are having 18 gram percent hemoglobin, healthy cells, healthy diet. We have the healthy diet over here. So in this way, hemoglobin is not normal. It means the cells which are carrying that iron particles, part of that one, is not normal. And they are prepared by the bone, they are not normal. The persons are weak, tired, breathlessness, and yellow face, because there is no blood. All these things we are indicated that the bones are weak. Relatively, spleen is not working normally. Spleen is sending the weak cells to the circulations, and they are not able to carry on the normal load of the body. It is circulating in the blood vessels, but they are weak cells. So these type of many things, it's a normal part. What I told you, it's a normal part of that one. But second, other thing is the major function of the spleen in this side is that garbage. Many time I told you that in each and every cell, there are trillion cells of the body. In each and every cells, blood is going inside. It is providing oxygen and food to the cells. Garbage is coming back via venous circles, and there is another thing which is filtered from the blood, coming back blood, returned blood. That is the garbage. And that garbage, if the cell is sick, just like there is a cancer in any part of that one, and all the cells are having the significance of that indications of the cancers. And ultimately, they will be producing more garbage, more garbage, more garbage. And then the third channel, that is known as the lymph channel, which is going parallel to the artery and veins. Arteries are bringing blood to the cells, veins are taking back blood from the cell to the heart. But the third line is known as the lymph channel. That lymph channel carries the thick portion of that garbage into it, and it stores in the different places of the body. There are junctions. Just like if you have a injury on the foot, you will be having a tumor, swelling inside the inguinal area. If you have any injury on the hand, you will be having in your armpit, there will be tumor or painful kachrali. People in India, people say the kachrali. All these things we say because something garbage is collecting from the distal portion of the body, and body wants that it should not go to the whole body. It should be localized here, so that it should not disturb the whole functioning of the body. It is stored here. But if the garbage producing area is normal, just there's an injury or there's an ulcer, there's something, and that has been repaired, and ultimately that axilla armpit tumor will go, that inguinal tumor will go, because these are the junctions of lymph nodes. But I'm talking about the spleen at this time. If in case that garbage is excess and is not controlled by these lymph nodes, these are known as lymph nodes. Function of the lymph nodes is also like the spleen. They also swallow the bad cells. They also clean up the normal cells. Whatever the cells are clean, we are buying the tomato from the markets, and we take it good tomatoes from all that one, and the rotten or all that, we throw it over there. The same way, these glands separates the healthy cells from that one and send them to the bloodstream again. But whatever are the damaged cells which are not able to work into the bloodstreams, these glands swallow them, eat of them. That's known as phagocytic function. Medically, this is known as phagocytic function. So they eat all those type of cells. But suppose there is a limited, there is a quantity, that how much they can do, how much they can eat. Ultimately, any cancer type thing or any chronic type of inflammation in anywhere, garbage will be more, and garbage will be every day, and garbage will be excess and excess and excess. Ultimately, the lymph node will be painful. And ultimately, when there will be overload of these glands, they will send again back to it goes to the spleen. Their head office of all the lymph channel is the spleen. If ever there is any damaged cell coming from the stream, whether it is coming from the bones or whether it is coming from any organ, the cells of the bloods are not normal. They are damaged. They are not able to work normally into the bloodstream. It goes to the spleen. It goes to the spleen. Then what happens? Spleens try to clean them. That's the big boss. Spleen try to clean those cells, but if they are in excess, there is overload, more garbage. I told you about the cancer type of things, leukemia and lupus. These type of diseases, they produce more garbage, more garbage. Every day it's increasing, and lymph nodes are increased, and also the spleen, the big boss, is also overloaded. Then we see the spleen comes out of the ribs. First thing, there is a pain, but that pain indicates the spleen on the left side of the rib is coming out of the ribs. This is the first thing. And it's painful because more load is there. It's not carrying up, it's not able to clean everything or swallow everything. No. So ultimately, the excess of load will cause the tenderness, pain, enlargement of the spleen, splenomegaly, or there are many more other names. Forget that one. That's That's up to the doctors. They will give give the names. But you just understand that the spleen is enlarged. Spleen cannot fulfill the demand of the body because it cannot clean all the cells which are coming from the damaged part of the body. So in this way, but still there is a one hope. There is a one hope. There is a one other gland. That gland is situated on our heart. That is known as thymus gland. That is also the bigger boss of spleen. If the workload is not carried out by the spleen, it will be carried out by thymus gland. And about the thymus gland, I have already told you, because when this new life starts, after the sperm of the male and ovum of the female meets in the fallopian tubes, a new life starts. And at that time, that new life is not having big protection of its own. It's not having that much big protection because they both of them lost their food. Whatever the food was carrying from the backside has finished. Sperm started from the testis, go to the routine, ultimately meet to the ovum. Their food is finished. Now they are weak, but ultimately they are meeting with the ovum, and they are mixing up their foods. But still, ovum has its food coming from the ovary, but that's also a limited food sites. And at that time, you can say with the limited food, they are surviving. It means they are weak. Their immunity is weak. But at that time, गुरबानी से रे भैया काहे फिरता फूलिया फूलिया जब 10 मास उर्द मुख रहता शोधन कैसे भूलिया. That's the condition at that time. At that time, who was responsible for them? Who will in our cities? Police protect us. If there be anything, we complain to the police. Police protect us. In the body, I told you, if the cells are damaged, anything else happens, our lymph node controls that one. Our spleen controls then if it's overload from the spleen, the thymus gland is controlling them. And where the thymus gland starts, nature starts the formation of the thymus gland at the very first fifth, yeah, you could say the first week. That is the third week. Basically, that becomes the third week. Because every pregnancy we count from the first day of last menstruation of a female. A female menstruate every 28 days, and when she becomes pregnant, and then they are starting a new life with sperm and ovum, that is the third week when this thymus gland appears. And that thymus gland takes responsibility for the survival of this new life. At that time, less food. At that time, less protection. But at that time, nature produces a thymus gland with which this new life is protected. Ultimately, this thymus gland develops side by side with as the child develops in the mother's womb. Ultimately, this develops over there. And when child born after delivery, still this thymus gland is active. And ultimately, when the child grows from newborn to toddler's age, this gland gradually stops its functioning because the child is having its outward food and outward protection, outward immunity to protect him. That is why the thymus gland said, okay, now I'm retired. You need not me anymore. So I'm retired. So then it becomes a small bubble like on over our heart. Everybody on their heart, they are having a thymus gland, which is the smallest bubble type. Ultimately, I'm talking about the spleen. And if the spleen is overloaded by any reaction, by anything happens inside the body, then she requests the thymus gland, please, if you can control, help me. Then thymus gland under those conditions, and just like You are driving a car, your gas is finished, and there's a reserve gas. Okay, now onward you can go about 30 miles. Okay, then you have to go to the gas station and put the gas in that one. In the same way, this thymus gland at that time again becomes activated, and because the spleen is enlarged here, it is coming out of the ribs, it is painful. And there are many more other things I will explain in the next day, because today the time is over, because a big detail I can give you, and I want to give you the limited details so that you can understand, you can follow all those things, instructions in your life, and you can protect yourself. If ever there be anything happens to your body, you can understand what it is and how I can correct it, and what are the causes behind that one. So I will talk about spleen again later on. This is Gurdeep Singh Sandhu, your homeopathic consultant. My clinic address is 9701 Sarah N Court, Dublin, California 94568, and phone number 408 687 1899. Email address homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime when you are suffering from any disease at any age and you are tired of any treatments, please call me for your second opinion. And if you want to be treated with the scientific approach of homeopathic medicines, call me 408 687 1899. And if you think these lectures are beneficial to you and you get some knowledge about your body, then please convey this message to your nearest and dearest so that they can join me on Facebook as a Facebook friend, and they can listen every day this program, Health Education Lecture Series, from 5 to 6 p.m. Pacific time, California times. Or if they are unable to attend at that time, they can come to my YouTube channel, Homeopathic Natural Medicines by Dr. Gurdeep Singh. Sehat Vigyan. The name of the program is the Sehat Vigyan Health Education Lecture Series in the YouTube as well. And also, you can join Sabrang radio station. You can download the app of sabrangstation.com, sabrangstation.com, and you can listen 24-hour entertainment programs, Gurbani programs, and every day from 5 to 6 p.m. you can join me for this health education lecture series, and we are describing the how the life was prepared, how the life originated, how it develops, what were the hurdles in the life, and how we can correct those hurdles and become healthy, healthy living. So all these things we are describing in these programs. And if you like that, please join me, as well as ask your friends to join me so that we can convey this message to the masses. My purpose of this life is to convey this health education lectures to the masses all over the world. So Rab Rakha, God bless you all. We'll see you tomorrow for the next lecture of this left hypochondriac areas, and we will discuss about the spleen in detail. Thank you.